Hello from wherever you're watching. This is More Healthy News. Dr. Mark Di Pasquale here, chiropractor from Adjusted Family Chiropractic, bringing you some latest research actually published in the Journal of Pediatric, Maternal and Child Family Health Chiropractic on the 4th. I'll just move myself out of the way there so we can actually see the article here, published on the 4th of October. So this is a publication entitled Improved Health Outcomes Following Chiropractic in a 13-year-old male with May-Thurner syndrome, superior mesenteric artery syndrome, and lower back pain. So a case report and review of literature. If you like fancy terms and big terms, you'll love this one. I'm going to bring it down to normal English, I suppose, or easy English, and just spend a couple of minutes on the outcomes of this study for this young boy. Absolutely fantastic how chiropractic was able to help him. So what this does is this paper here describes the chiropractic care of a pediatric patient presenting with lower back pain, May-Thurner syndrome, and superior mesenteric artery syndrome. So first of all, get into the case. So he's a 13-year-old male. He presented to a practice with lower back pain. He was having it for 2 months. There's 2 months duration. It was an 8 out of 10 with regards to on a pain scale. It was aggravated with movement in the lower part of the spine, the lumbar spine, on bending and twisting, body movements in general, and when he was lifting as well. And CT scan was actually done on him, and it was revealed that a superior mesenteric artery syndrome, May-Thurner syndrome, and decreased height of the L4 disc with some of the bulging, or some of the disc at the L4 was actually bulging. So I'll just go to just to show what the mesenteric artery syndrome is. So here it is, a couple of diagrams here. It is a syndrome, or the syndrome, and it's a digestive condition that occurs when the duodenum, the first part of the small intestine, is compressed between two arteries, the aorta and the superior mesenteric artery. This compression causes partial or complete blockage of the duodenum, so of the small intestine. So partial or complete blockage of the small intestine. Quite a problem if it actually advances. Now, also I'll move over to May-Thurner syndrome. It's caused when the left vein, the left iliac vein in the pelvis, is compressed by the right iliac artery, which increases the risk of deep vein thrombosis, or DVT, in the left extremity. Deep vein thrombosis is a blood clot that may partially or completely block blood flow through the vein. So quite problematic when they do progress. So quite fantastic that this young man actually had a resolution of his problems. So if we actually go into the intervention or the outcomes of this case. So before he presented to the chiropractor, he had so self-care with heat, essential oils, and ibuprofen were unsuccessful in helping him. And then with spinal adjustments using a combination of Thompson, diversified, and Gonstead techniques, it's interesting to just mention now, or topical just to mention now, there are many different chiropractic techniques that are used in practices, depending on what's been trained in college or what has been gone on to learn in seminars and conferences, and training programs and further education by the chiropractor later, after graduation. Now, this young man, by his 10th and 11th visit, he experienced relief of the pain symptoms with only mild intermittent lower back tightness with activity. So that's tremendous. And there were no adverse events that were experienced by him as a result of the care that he received. So really, this has set up the foundation for further care, being more spinal reconstructive care to stabilize that L4 disc, get that bulge out of that disc as well, keep that spine aligned correctly so that the issues with regards to the duodenum and the veins and the vessels can have a chance to work correctly. Now, also a thing for us to speak about now as well is the thing that the spinal adjustments would have been getting on track as well is not only alignment of the spine, pelvis, etc., but also making sure that the nervous system is functioning correctly. The nervous system of a person's body is the master control system. And if it's working well, we expect that the body can make changes and work well in functioning physiology of everything that it supplies. So this is why chiropractic gets great results in many, many, many cases. So there you have it. This is an awesome. When it came across my desk, this research article here, and this 13-year-old boy, where would he have been if he didn't go and see his chiropractor, didn't get all these tests done, didn't get this care done? When he would get older, things would be much more difficult, and health and physiology just wouldn't be as good. So great outcomes. So if you have any questions for me, just please contact me. If you have any questions for our team at Adjusted Chiropractic, we're here. You can contact us as well. Look after yourself out there. Look, it's important that we look after our health, because no one else will, and it's very, very important. Bye for now. That's been another episode of Healthy News.